So it is a little bit of a challenge. So we're really trying to change the culture by putting on events where people can come together, we serve food and drink, and they can brainstorm and kind of force those interactions so that they grow more organically. But there is a challenge in terms of just the incentive structure in the hospital to, it's one thing to say we think research is important, but you have to put, I think, the incentives aligned with those messages. And currently it's a little bit of a struggle on that side of things. But we do a lot of education. We do a gap funding program where we have a 6-month workshop, 6 months of workshops, and we're kind of exploring and experimenting with a lot of different ways to get people engaged. When I started, we got probably maybe 5 to 10 invention disclosures a year, and I think this year we'll have a little north of 30. So the word is spreading, and so we're kind of the victims of our own success. It's a good thing, but I think once you have a few successes, we spun out 2 companies this year. So for us, that's big. We have a $50 million research budget, so it's very small in comparison to a lot of the universities around town. But we did 2 startups, and of course, once people had a good experience with one of those, the word kind of spreads, and everyone wants to do them. The trick for us is that our faculty are not very well connected, and so they really look to our office to make those connections, help them write the business plan, and connect them with the world out there. And so it's a lot of heavy lifting. One of the 2 startups that we did, I helped find the consultant to work with the team to really understand where the technology was and where we needed to take it. I went on site visits to kind of vet contract research and manufacturing organizations for the company. I helped develop the operational plan, pitched it to the investor. I mean, it was it took probably 30% of my time. I can't do that for everyone. It so happened, and interesting, this is another trend. We're seeing a lot of kind of venture philanthropy. So these are donors that might have supported the research that now see that we have some cool proof of concept data and that want to see this, move to the clinic. So all of a sudden they go from donor to investor. So we're seeing a lot of that, and even upfront donors that say, I want to invest in this area, and but I want a mechanism up front. I want to know how this is going to move out of the academic setting and into a company, into the market. So that's another trend I just wanted to mention that I think is pretty interesting.
Yeah, venture philanthropy actually is in its very nascent stages. You're all familiar with the Michael J. Fox Foundation. That's one of the initial original venture philanthropy. Although, as you know, his Parkinson's Foundation doesn't take a stake. But multiple sclerosis, lymphoma, leukemia, they actually take a stake now. And there are a few others that we're trying to talk them into, such as the Hope Odyssey people, Hope on Wheels, right? Up in Orange County. I don't know if this is where you wanted to head, Joel, or not, but in terms of where PIs want to go, whether they want to be PIs, whether they want to be CPOs or not. But you're probably aware that the NIH is, right now, I think they're trying to spearhead at least 15% of their budget into commercialization efforts. And in fact, as an advisor to the NIH, I get probably a dozen grants a year for go or no-go, and my recommendation for go or no-go is expressly with regard to Martin, is this a dog that's going to hunt or not? And if I don't think this dog's going to hunt, the answer is no. Let's not spend the money. Because way back when I started out a million years ago on a cervical cancer venture out of Hawaii, the NIH was saying, gee, Mark, would it be great if just once? Call me crazy, but just once would it be great if one of these things that we funded actually ended up in the market? That's crazy. That'll never happen. But getting back to the trend thing, I guess, full circle, and maybe this is Joel where you were headed or not, but when I was thinking about what to yak about, I thought, well, what type of support tools are there these days, or organizations or entities for those of you who are interested actually in a startup venture and so forth. And the National Institutes of Health actually will designate people such as yours truly to take you by the hand and walk you through commercialization if you're all interested, and it's free of charge. If you get to phase 1, if you get to phase 2, it's the deal of the century, go for it. fact, those of you who do phase 2, you're asked to put together this god-awful looking 10-page commercialization proposal now, right? You're probably familiar with that, but they're deadly serious about that. Now, with regard to PIs who really want to proceed with a venture, the downside is that, as Jessica and Hannah had mentioned, is that they're, as my daughter would say, gee, Dad, these are wicked smart people, but that doesn't mean that they can take something into the commercialization side. So the question that we as investors and VCs ask first and foremost is that, are you coachable or are you not? If you're not coachable, God bless and Godspeed, you're not going to get money from us. And are you willing to pass the baton over to someone who can take it to a higher level? Are you okay with that? No, because I want to keep 90% of ownership of my company. Well, then we can't have it. That's not going to happen. But, you know, it just occurred to me, well, what kind of tools are there out there? Well, there is actually a consulting firm out of Providence, Rhode Island, has this big contract for any of you to get a phase 1 or a phase 2. They'll help you. I mean, that's their job. They get funded by the NIH. It's called Foresight Science and Technology, and they dispatch a team of people who will work with you, and they won't do your business plan, but they'll do something called a technology niche analysis, which gives you some pretty solid information. And I did a list, and I don't have my glasses on, my arm isn't long enough, but I thought, I asked myself, well, gee, you know, what if someone from the University of California needed some help in moving forward with a venture? Well, there's a minimum of 25 accelerators, incubators. There's Springboard Connect, there's the SBDC, which is funded by the Jobs Act of 2012. There are a ton of experts out there who are motivated and incented to help you move in that level and increasing that transfer.
Let me give you a perspective, since I partner with researchers. I'm not consulting to them. I'm not certainly not being paid by taxpayer money to sprinkle wisdom on other people. But just not. In fact, I've been sat through many evaluations on different parts. I'll be the party spoiler here. It's mostly a waste of money and time, because if you have it, you have it. If you don't have it, you don't have it. In so many terms. And if you don't have it, all this help might take that little gray area between when you might have it or not know about it and move you over. So when we look at things, we make a very early assessment. Does this technology fit our sweet spot? Does it have some possible legs? Some things that Jessica was talking earlier that she's doing in terms of what will be out downstream, the commercialization path, reimbursement, competition, all that stuff. And the immediate thing we do, in fact, immediately is this a researcher we can work with? And they categorize it in a few buckets. Some have it and want to do it. In fact, we will cheerlead and just not get involved because we don't have the time to do it, but others people will. Minority, very few, because it's not easy to be an entrepreneur. Many of those, however, think that being an entrepreneur consists of harassing investors for money. And if I were to ask you, if you had money, would you be immediately successful? The answer is no. You think you are, but no. In fact, the chances of you getting the money is already very slim anyway. Not only from the grant track, but even more so from the equity track. Much less. Not even tougher, and it's getting tougher. The pendulum is swinging. I think 2 years from now we'll see a much better climate for active investment in early stage biomedical, but right now it's very tough. So, so you have those who know they can do it, those who think they can do it if they just get money. Then you have other researchers who really generally want to stay in the lab, and I think that's probably a minority, or maybe not, because we don't see that much. But then we have this other, which for us is the sweet spot, which is a researcher who knows that he or she is not cut out to be the CEO of this venture. He also knows that the value of the idea is not 99% of the new venture, just because it's an idea. The value is an execution for years and years to take this and turn it into something that is commercially valuable. And those are the ones we partner. The ones who say, look, I'm passionate about this. I spent some time in my life doing it, not just because I happened to get a grant, because I was interested in changing the world with it. I took some taxpayer money in the form of grants, and I converted it into this thing today, which the university now is ready, willing, and able to license, and that's all good. I'm not being critical, but actually I love them all, right? Because non-dilutive R&D brought it here, that gets recognized at a certain value in the transaction with the university, and the researcher now wants to continue being that, a researcher, a scientist, working, in our case, still at the university where they came from. We're very interested in hiring them all. Everyone loses in that case, certainly in the early stage. And by definition, we self-select for that, so it's not that I'm looking at others. But I can tell you that many times I've come across, in fact, I'll finish on one of the three, one more minute, and that has to do with, earlier I mentioned that I did one round of contact to all the tech transfer offices in Southern California for 5 projects proposed to us, and I'm just going, my team and I are going through that. 2 of those, in fact, no, true, 3 of those consist of IP where the researcher tried to commercialize it and failed. That's actually our best partner, because that researcher knows what they're all male. That researcher knows what he doesn't know. He knows what he doesn't know, he knows what he needs to know, he's looked at the future, said, this is not my thing. So I'm going to back out that initial attempt to commercialize it and now get myself involved with someone where my value added, which is not commercialization, ties to the others who do, and I'm going to continue to perfect the science with the purpose of now finding a commercialization channel. So that's my thing.
All right.
So actually, can I jump in there real quick on this? Because I'm kind of in between Martin and Richard on this. So,
All right, so let's hear from Alan and Justin too.
yeah. So I think if you want to be an entrepreneur, you want to start a company, I think ultimately, I like the idea of students having mentorship, but ultimately if you want to start a company, you do it. You figure out what you need to do. That's what makes an entrepreneur an entrepreneur. You figure out what you have to do. There are problems and there's no proven track that you follow this path and you go step 1, step 2, step 3, and you got a company at the end of it. There's all sorts of things you just have to figure out. And the resources are out there. You've got to go find them and figure it out. So I think my 2 cents is, if you think you want to be an entrepreneur, you think you want to start a company, you just got to do it.
Yes.
I wanted to address something a little bit different, Joel, that just to address more how we can better engage faculty in kind of the tech transfer process. And one model that we've been experimenting with, which has worked really well, is a center called the Center for Technology and Innovation in Pediatrics, which is run through CHLA. It's a recently FDA-funded center to commercialize pediatric medical devices to serve innovators not just at USC or CHLA, but all through Southern California. So we just got this grant a month ago. But we've been establishing the center for a couple of years, and the reason I bring it up is that it's a co-leadership model. So I co-directed with a clinical faculty member. And I think that's done a lot for our kind of street cred and across the campus, and just for the integration of tech transfer as being an important part of the hospital. So, and we play to each other's strengths strategically, so there are certain things that I can do more effectively and some things that he can do more effectively. So we kind of strategically deploy each other depending on what we're trying to accomplish. And so it's just a model that's worked well for us that I think is a little bit different.
So I'd like to take moderator's privilege here for a moment and maybe change the direction of the discussion to a slightly different topic. And one that builds maybe a little bit on the comments that Alan gave at the beginning, right? Certainly when I look at the patent system, one of the things that I see is that there are more enforced patents now than ever before in the history of the United States, right? And that at least suggests the possibility that more and more often people who say want to start a business or start a company are going to have to aggregate rights, maybe multiple rights that might be under the control of different entities. And I was wondering if any of you had experience with that, and how you've seen those problems resolved, or whether you found those to be like thorny, transaction cost heavy problems, or whether they're the sorts of things that people are able to work through pretty effectively.
So I'll go ahead and start off on that. I'm actually going through that right now, where I'm with the current company building 3 pieces of IP that we consider necessary for freedom to operate and some exclusivity. And there are 3 different universities, and we're negotiating with all 3, and they all have terms, and they start with terms that are their standard boilerplate terms, and they're always coming from the perspective that well, you're just licensing our IP, and this is all you need, and once you get that, you'll go forward. And then you have to bring them up to speed and say, oh, we have multiple pieces of IP from other universities. Some folks get it, some don't, but you have that conversation. So I think the most important way to resolve those issues is building relationships and a certain amount of transparency. So when you talk to these other folks, you can't be guarded about the other parts of the puzzle. You need to fill them in and explain why these other pieces of IP are important and why aggregated together, that's the product, not just their part or this part, but together this is what makes the product. And being, I think, building a relationship so there's trust, and that's just true of every relationship, really, particularly in building a business. If there's not trust, it's not going to work. And then also just being transparent about what your needs are and what the technologies are that you're going to be getting from other universities.
Anyone else, anyone at the tech transfer side of things ever come across these issues?
Oh, yeah, no, I've certainly been on the other side of that, and pretty much it's worked out the way Alan's talking about it, in that the licensee I was talking to was very transparent and told me, look, here's this technology that we need from Caltech. We also need this other thing from this other university. Could you guys have some flexibility on your financial terms so that we can make it work? And of course, it's not in our interest to jack up our rates so high that it scuttles any chance that the company has of succeeding. So yeah, we're going to be flexible in a situation like that. I think, well, we certainly do. I don't know if most universities do this, but I would like to think that they would have terms that specifically begin to address that, even in our regular boilerplate, that say, if you need to pay a third-party royalties in order to get a licensed product to market, then you can actually credit some of those royalties paid to the third party against the royalties that are due to Caltech as the licensor, and therefore reduce the total royalty burden on that given product. But even if that provision isn't sufficient, then yeah, we can really talk about what we can do to make it even more palatable.
I think by extension of that, even once a deal is signed, it may not, the company may not be able to live with those terms as they raise money and evolve. So I think we always have to stay open to revisiting terms, because as Hannah said, ultimately we want to see the technology go to market, however that may happen. And so I think we have to be flexible even after the deal is signed.
I just one note on that I would add that when you go to negotiate with the tech transfer, I wouldn't see them as the opposition. They are absolutely a partner. And so you want to work with them as a partner and develop that type of relationship. Because that's the one that's going to be the most successful, and then they'll be the most supportive of you as well.
And from my perspective, from the slums, the other side of the track, the non-tech transfer, it has never been an issue for multiple IP with tech transfer whatsoever. Again, same as these two guys here, extremely motivated, extremely supportive, and never an issue in terms of negotiating terms for royalties and so forth. It has, however, been a little bit more of a head scratch or a headache to negotiate stake holding for the inventors and so forth. But again, I mean, your point is extremely well taken. Transparency, get them all in the room together and go through it. And everyone at the end of the day, so to speak, is motivated to get it. And they will all end up sharing generally what ends up being an equivalent equity stake, unless there's something that is so resoundingly distinguished from the other two. But you just simply have to walk through that with regard to the equity side of the equation. It's work, but again, trust, transparency is the name of the game.
I think, trust is key. Just recently, I had a licensee initially come with an email saying, we interpret the royalty clauses in such that we really don't owe you anything, basically, to simplify. But it was a very poorly drafted license agreement that predated me. That didn't go anywhere, and obviously didn't really put a lot of kind of goodwill. But he then came back and said, "Well, actually, here's what I'm really facing. I need some cash flow, because I think if I can reinvest what we owe you, we can see some payoff." And I'm really open to that, obviously, but it didn't really start off that conversation in the most constructive way.
Right,
It was
Bruce?
still receptive.
related question, I guess, to the patent conflict problem. How often is it exclusive, and what do you do with the exclusivity issue that presumably comes up? Because, you know, you can tie up the potential commercialization by having one company hold the patent, the assignment of the license, and do nothing with it. Meanwhile, you've got 3 others who would like a piece of it, but they can't give it because it's exclusive. So how often is that, how do you deal with that problem as a tech transfer office? Or is it not exclusive generally?
No, I think certainly vast majority of our startup licenses would be exclusive rights, at least within a field, if not across all fields, because the startup needs that. It's typically the only asset some of these very early stage companies have is this exclusive right to the core IP underlying their future products. What we do have, because we, as I said, our mission is to get the technologies out there and into the marketplace, is we have diligence provisions in our licenses that say, hey, licensee, if you're not putting in a good faith effort to further develop the product and market it and sell it, then we can terminate your license and get the rights back. And we put some teeth into that with annual minimum royalties as well that say, you know, even if you're not actually selling product, then after a certain point in time, you need to be paying us some kind of, some dollars a year just to keep the license alive, and otherwise, again, we can terminate and then get the IP rights back. So the last thing we want is to license the rights out to someone who's just going to sit on it and prevent anybody else from commercializing.
So can I just ask, just to follow that a little bit? So how many times have you guys exercised
That we've had to do.
those provisions? Yeah.
Well, I think it depends on whether, we have done it. Kind of depends on whether anybody is knocking down the door, and if you do have 3 other people saying, well, hang on, we're really interested in that IP as well. And that's often what would trigger us to kind of take a really close look at the current license holder and say, hang on, these guys are really kind of slacking and aren't doing what they need to do.
So let me share with you the strategy I've been learning. It's, you know, we all learn on the job, and there's more to learn than you ever thought you had to learn. And regarding this, what I'm learning is 2 things. One, trust came up already, but I already knew that for many, many years, having built businesses where you have to sell. And the #1 ingredient of successful selling is trust. It's not talking and features, functions, but it's interpersonal trust. So that's there. But the second part of it, within that trust, once you have that trust, so that both parties, you and of course the licensor, understand that you're not playing games, you're not needing, you're just trying to find the right time, is to actually postpone when you sign the license, for 2 reasons. One is because if you go ahead and encumber something that you can't execute, then you get into these type of lawyer dreams, where the lawyer's asking how many times you have to, you don't want to get into lawyer talk. You don't want lawyers in your life. You don't want lawyers. They will squeeze you dry, give you no money, and they will verify everything you tell.
Most important, best available model.
Continuing, so you don't want lawyers as much as you can. So you don't want to go early under some dumb, bullshit, made-up assumptions and get into that license. And the second part of it is in the nitty-gritty. The university, with all the love I have for my friends in the panel, are going to want, I exaggerate this much, and you want to give them this much, okay? Somewhere in between, you're going to come to a happy place. And there's all sorts of interesting clauses, I won't get into any of the details, that are very delicate with respect to dilution and equity and royalties, which are the 3 main pieces of the economic pie. So postponing, not for the purpose of postponing by playing games, but because you're doing work and research and doing your due diligence, understanding what you're getting into, which then you present to the licensor, says, this is the reality I've discovered. You may not agree, and we can discuss and perfect it from there, but this is what I've discovered. Therefore, this is what I think will make most sense economically, so that we all win. The researcher, the technology, the world that we're saving from itself with our device, everyone. So postponing is important, and they say, well, how do I postpone and protect myself? Well, there are ways to do that. There's options, there's trust. I mean, right now, in one of the technologies I'm working on, I have started a company, working in the research. I've been doing this for a year, and in fact, the clinician sits in her facility. I don't have a license yet. for this very reason. I'm putting together now, finally, the business plan after a year, after the discovery thing we didn't know, questions we didn't know we had to ask when we started. And now I'm getting ready, probably around 3 to 5 months from now, to sign the license, but at that time, I know we will sign something that everyone